People who have COVID-19 and don't know about it are a big factor in the spread of the virus. Could this increase the push for more widespread testing? And that's the question we want to ask Dr. Leo Lee, infectious disease specialist with Beverly Hospital, joining us now with his perspective. Dr. Lee, thank you once again for joining us.
Good morning.
Good morning. Recent studies show that over half of COVID transmission cases might have occurred from people who are not showing any symptoms. They're asymptomatic. So can you break down what that means, especially in light of the fact that many may only get tested if they have symptoms?
That is true, yes. A recent study that was published last week was performed by the CDC. It's actually a modeling study, which they looked at the rate of transmission from asymptomatic individuals. They did make certain assumptions, and they used data from Chinese studies from last year. And they actually changed a number of variables in terms that they looked at days of incubation, days between onset of symptoms after infection. And what they determined after playing with different variables is that 59% of asymptomatic individuals can actually pass on the virus. Basically about 24% were individuals who never showed symptoms, and the remaining 35% who actually were able to shed the virus before they developed symptoms. So that has significant implications in terms of mitigation practices. We are still recommending that people wash their hands, social distance, and wear their masks. But on top of that, it's also important for us to screen individuals who've had credible exposures to make sure that they don't fall in that group that can actually spread the virus.
So that means we do need more widespread testing then.
Absolutely, yeah. Absolutely. In order to get things under control, we do need to test more people.
Yeah. Well, many people.
And they should only be tested and they shouldn't only be tested when they develop symptoms. They should be tested when they've had a credible exposure.
Ah, that's key. Now, many people wondering, is it possible to get a COVID-19 infection even after you've received the vaccine? Is there a window of time where immunity is building?
Yes, there is. In fact, a number of our staff members, I'm aware of people in the community who've actually developed COVID actually after receiving the first vaccination. Like anything else, the immune system needs to be prepped. And so the first shot will actually give some immunity based on studies, roughly about a week to a week and a half. That's for the Pfizer vaccine. For the Moderna, it takes about 2 weeks. But to reach full immunity, it takes about 2 weeks. 2 weeks after the second dose for the Moderna and a week for the Pfizer. So you need to give your body time to build up immunity. You are still.
Yeah. Well, what do we know about that variant that we have been talking about in the news in terms of whether or not the vaccine is effective against it? Talking about the one from the UK.
Right. The UK variant has been around since September. It was first noted then. It has spread like wildfire. It is currently in 50 countries, including the U.S. From what we can tell, the vaccine should still be effective against it. What we do know about the variant is it still causes illness, but it doesn't seem to be more severe compared to the current strain that's circulating in the U.S. But the vaccination seems to be effective, and you should get it when you have it available to you.
All right. That's like a little ray of sunshine. Dr. Lee, thank you so much for joining us. We appreciate it. Have a good day, sir.
Thank you for your time. All right. Bye-bye.
Bye-bye.